I'm Professor Jerry Raymond. I'm a consultant diabetologist at the Ipswich Hospital. Over the last 10 or 15 years, I've been working on inpatient diabetes. I developed the National Inpatient Diabetes Audit, which is now used every year across England and Wales, and has been an important instrument in driving change.
I'm Candice Ward, and I lead the Cambridge Diabetes Education Programme, CDEP, which is an online e-learning programme about diabetes for healthcare professionals. CDEP has been developed by the Cambridge University Hospitals. We all work in Addenbrooke's, but we provide a UK-based platform for NHS healthcare staff to reduce variation in care, promote good, optimal diabetes care, and improve patient safety.
My name is Kimberly Littlemore. I am the Creative Director of eHealth Digital Media and a former BBC producer. We collaborate with CDEP to create engaging and potentially life-saving training information films for busy healthcare staff.
In medical schools, people are taught about the physiology of the pancreas and the pathophysiology of diabetes, but actually the delivery of diabetes care is really not taught, and that is quite disturbing. Nurses, like doctors, are trained within universities, but not actually how to treat a patient with diabetes and not the consequences of getting it wrong.
National audit stats show that 50% of insulin charts have a prescribing error. That's pretty scary when you consider that insulin is the third most dangerous drug in the world when used incorrectly.
The harm for patients in hospital with diabetes is that if you come in and you have a diagnosis of diabetes, you've got a 1 in 5 chance of going hypoglycemic whilst in hospital due to an error. That accounts for about 140,000 episodes per year across England and Wales. But even worse than that, if you take the most severe error, that is unconsciousness as a result of mismanagement of insulin, we're talking about 10,000 episodes per year, which is really quite disturbing, particularly as this can result in death. Hypoglycemia, in its mild form, it's unpleasant, but in its severe form, it is absolutely frightening, and potentially it can be fatal.
A hypo is when the blood glucose level falls below 4 millimoles per litre. You probably know the symptoms: pale, sweaty, shaking, anxious, hungry, confused, unable to speak or concentrate. Remember to think about sleeping diabetes patients. They could be unconscious.
CDEP approached us off the back of our Preventing Hypos in Hospital film to collaborate with them to develop a bite-sized film to support the insulin safety e-learning topic that they were developing. The film was designed to be an introduction to CDEP's insulin safety e-learning training, to refresh knowledge and to boost confidence for administering insulin safely. Professor Jerry Raymond uses CDEP for online staff diabetes training in Ipswich Hospital. They decided to also use the film for face-to-face ward training with great results.
Over 600 healthcare professionals, including junior doctors, ward nurses and pharmacists, were taught using the 5-minute video. Really great, easy to deliver on a tablet, on your iPhone, or on a laptop if necessary. And you can see by the end of September, in a short period of time, our insulin errors had reduced, further in October, and by December down to 20%, which was really quite remarkable. So there's no doubt this has been very effective, and the staff liked it. And the fact that it only took 5 minutes was just terrific. And I thought, well, here's the proof of the pudding.
Due to the success of the hospital-focused insulin training, we decided to create a second package aimed at supporting staff working in the community, care homes, primary care, or non-acute wards to also deal with insulin safely.
Since we started making these training films in 2019, they've been viewed nearly 15,000 times, and they've been downloaded hundreds of times for use in training sessions. We've also made a series of films identifying how to use all the different insulin pens that exist on the market. So what we're seeing is there's a real demand for this kind of content to train people who are busy healthcare professionals on the ward and in the community.
The video contains brief and essential messages, and that's the beauty of the video. It is delivered in a short period of time, but they are the essentials, and they are delivered in a very clear, both auditory and graphical form. And it leads you into the platform of further learning on diabetes care.
CDEP uses a blended approach in not only providing the written material, but we use films and pictures to be able to provide a good, complete learning platform for people to get the most out of the training. We've had a 200% increase in our topics and people accessing the site. So over 1,500 people have completed insulin safety training in the first 5 months of the pandemic, which is just a testament to the dedication of staff, but also how easy it is to access and complete the training we provide. CDEP is already embedded in about 40% of the CCGs in England and throughout the whole of Wales. Over 20,000 healthcare staff already undertake our training. In the last 5 months during COVID, 18,000 hours of diabetes training has been undertaken. We are producing 80 certificates a day, 7 days a week. So this is all proving that CDEP is doable in busy healthcare staff's lives.
Across the country, there are tens of thousands of patients who suffer from harm from getting insulin prescribing or the management of diabetes, getting it wrong. And there's no doubt that we can improve that quite significantly. And this program itself, I think, is a major step forward to this.
We've worked with a wide variety of people to deliver the training we do, and we'd like to thank them for their enthusiasm, their expertise, and their guidance and advice to develop CDEP into what it is today.
I really do feel that of all the programs that I've worked on recently, this is the one that I think is going to make a big difference to people in hospital with diabetes. So I hope success with others, but I think this is brilliant.